And Charlene.
Good morning, Senator
Thank you.
and Chairman and the rest of you. My name is Charlene Quaddy, and I'm an attorney here in Boise, Idaho, and I've presented in front of you many times before. I'm here to also speak as a parent of a child who is now 28 with developmental disabilities. The reason I went to law school at age 42 was because I saw the pendulum swinging in what I perceived to be the incorrect direction. My daughter was able to progress through her special education program, receive excellent what we call transition services from 18 through 21. She learned how to do some volunteer work and to work. She volunteered at the VA here in Boise, and then she went on to learn how to ride the public transportation, and now she works 10 hours a week unsupported competitively at the restaurant that she works at. I say that because I'm dovetailing on a little bit of what you heard from the Director of Disability Rights of Idaho and others, that supported employment is important. It does move our individuals with disabilities from no activity to also some gainful employment. Last night, just for another purpose, because you're listening and I appreciate you hearing the stories, I'm going to share another one. One of Rachel's friends is a young woman who just graduated from the STEP program at Boise School District. And this young lady graduated after her 21st year of age, and she actually is now competitively employed at a veterinary hospital or clinic. And this is a success story because she received that transition service through her high school services, and she received that supported employment while she was there, and now she is working competitively. So I share those stories because they are success stories. We also, unfortunately, because I work, what I'm going to talk about is in some unfortunate situations. I work all over the state of Idaho helping students with disabilities or parents with their children or adults with disabilities. And I see some tragic situations where perhaps we don't have a comprehensive approach to our education and our health and welfare services, and we have children falling through the cracks. We have, as you've heard testified today, children who have some difficulties with neurological complications, whether they're on the autism spectrum or they have emotional behavioral disorders. And those children are falling through the cracks. They're being incarcerated as a result of their disability, and that is putting incredible burden on our juvenile justice system, and those children are not being trained to the extent that they need to so that they can move on to receive services for competitive employment. I use those two examples, Rachel and her friend and their success stories, and those situations that we do have throughout the state of Idaho that need some attention. And since you're listening, I'm just encouraging you to look at that and perhaps deploy some ability to look at a comprehensive approach to both education and health and welfare. Thank you so much for your time.
Thank you. We have Marilena Delgado and Taronda Robinson and Nikki Tanger. Marilena, would you like to come up?
Hi. My name's Marilena Delgado. I'm 49 years old. I'm from Orfino, Idaho. I too drove 6 hours today to come speak to you. I've currently, for the better part of 25 years, have been uninsured. Therefore, any kind of medical I have to address, I usually go to the emergency room, which leads to great big medical bills, and any kind of referrals outside of the emergency room I have to cancel. I can't go to. I kind of learned to live with that for the past 25 years, only because I know my kids are covered on Medicaid, and I was okay with that. Now that I'm getting older, I've watched my father lose his life